Dr. Zappi at the Wellness Center in Chester County going to give you some really good quality, high quality low back stretches that you can do if you're experiencing low back pain. Sorry that you're experiencing low back pain, and if you need help with anything, we'd be more than happy to help you out. Always check out our website. It's wcofcc.com for more information. But for now, we're going to give you 3 stretches to take home. Try them out. If it seems to give you relief, that's awesome. If it doesn't, for any reason, you can always contact us and we can help you out a little bit further. So, first thing we're going to do is we're going to try and stretch out these muscles here in your back. They're called your QL, more commonly known as the quadratus lumborum. That's their actual name. But in any case, what they do is when they contract and squeeze down on your spinal column, and it causes compression, and that can cause you pain, and it can cause some different problems that we really don't need to get into right now. But let me show you the stretch, and if it seems to help you, that's awesome, okay? So, if you've ever been to a chiropractor before, you've probably been familiar with this kind of position, okay? We're going to do the exact opposite of that position in order to stretch that area of your back, okay? So your bottom, you're going to lay on your side at home. On the floor is fine. On the bed's a little too soft, so if you can get a nice firm surface, that will be helpful. You're going to lay on your side with the problem side up, and if the low back hurts right in the middle, do them on both sides, okay? So problem side's going up. We're stretching this side today. We're going to bend the bottom leg up all the way as high as you can. Then you're going to take the shoulders, and you're going to turn the shoulders onto the floor, the table, wherever you're at. Take this leg and stretch as far as you can, and you're creating length in this area of your back. Take this arm and reach up as high as you can and try and get your shoulder onto the table. So you can sit into that position for a good 10 to 15 seconds. I really wouldn't sit into there for like 2 or 3 minutes. It's kind of going to start aggravating things. So 10 to 15 seconds at a time, then get out and you can go on the other side. Once you're done that, you can do another stretch to try and help with some other things going on in your back. And this is more of a mobility drill. The more movement you get into the area of your spine, the better it should start feeling. The more stiff you get, the more it hurts. Okay? This is why when you're getting up and moving around throughout your day, it's probably why it doesn't feel as bad, but when you first wake up in the morning, it hurts a lot more. If you haven't been moving for at least 8 hours, you've been sleeping, okay? So get movement into your spine, it's important. So you're going to take your legs and spread them out outside of your shoulder width. Take your hands and put them in the small of your back. Bend backwards over your hands as far as you can with your head at the same time, okay? A lot of people like to do it like this. Try not to do that. Keep it back, okay? You're just going to do about 4 or 5 of them. You don't want to do too many, okay? By doing too many, you can bang the facet joints in your back and cause more pain. So you don't want to do too much. Just a couple movements just to get it nice and loose and get your day started. Once you get your QL stretch going and you get your low back extensions, we're going to stretch the anterior side of your hips. These are called your hip sockets and your hip capsules. There's a muscle that comes from here. It's called a hip flexor muscle called your psoas that does hip flexion. The more movement you can get from your hips, the less movement you need to get and recruit from your back. So we're going to try and loosen your hips up, which will actually help your back out, okay? So by stretching this muscle, you're going to go down on one knee, and you can move your pelvis in 2 different directions, okay? You can move your pelvis backwards like this and stick your tailbone back, or you can tuck your tailbone underneath like this, okay? I want you to do that one. I want you to tuck your tailbone underneath, okay? So, first step is get down on your knee. We're stretching this side. Get up nice and tall, nice proud chest. Tuck your tailbone underneath. That should bring the stretch on right away, okay? Once you have the stretch, we're going to move into different planes to try and add more dynamic stretching into what we're doing. So, now that we have this stretch on, you can lean forward just a little bit. Arms go up. You're going to lean away from the side you're stretching and turn towards the side you're stretching. That should maximize the stretch and get you as much length as you can out of it. If you feel like you lose the stretch when you do any of those movements, tuck that tailbone back under. You just lost that pelvic tilt and you need to get back to the stretch. So if you lose the stretch at all, just get that tailbone back underneath and that'll bring the stretch back for you. Same thing, you can do it on the other side. Tuck that tailbone, lean forward, lean away, turn towards.
And you can sit into that for about 10 to 15 seconds. Same thing, don't hang into it for minutes at a time. 3 or 4 passes is fine. As many times as it takes for you to feel loose. If you're not feeling loose and it's taken more than 6 or 7 passes, you might need some professional help, so you can feel free to give us a call. But other than that, those should help you out a lot. If you need any other information, our website is wcofcc.com. Our phone number is 484-341-8598. I'm Dr. Zappi. Have a great day.